am Captain Neethu from OSCE Success Hub. Today, I will discuss one common questions you may get during the interview for registered nurse job. The question is how to handle a difficult patient. So, uh, while discussing this, I just don't want to give you a ready-made answer. I want you to understand the concept. What is a difficult patient, and in what are the situations we face these kind of patients, and what are the characteristics of this patient, and what are the management techniques we need to follow. You need to understand all these things first. Then I will tell you after understanding all these points, how to inculcate all these points into your answer as when you present it for the interview. And I will give you one example in the last of the video so that you can identify how I included all these theory portions which we have discussed regarding the difficult patient into the answer. So let's start the video. Who's a difficult patient? A difficult patient is a patient who challenges the healthcare staff in their ability to provide safe, effective, and respectful care to the patient. Let's see what are the situations we can get a difficult patient. The first and foremost reason may be pain and anxiety. Sometimes the patient may be admitted in the hospital with the pain issues. If the pain is not addressed and treated properly, that may agitate the patient. He or she may get frustrated, and that frustration can be shown towards the healthcare staff. Same like anxiety. Admitting in a hospital may be anxious for the patient because of the new environment, the new things which he or she is being exposed to. So all those things puts lots of pressure on the patient, and this pressure can be expressed as an anger or a frustration towards the healthcare staff, and this patient becomes a difficult patient for us. Next reason is lack of control and also unmet expectations. Maybe sometimes while the patient is getting admitted in a ward, the patient may be expecting the level of care which he or she received from us. If that expectations are not met, that might be a reason for the patient to show some frustrations. And then lack of control. Sometimes as the disease progresses, patient may not be able to have a control over the life situations, isn't it? The psychological and the physical situations the patient is in challenges the patient himself, and he identifies he is not having a control over his life situations. That itself can cause frustrations in the patient. So that can also be a reason for the patient to behave in this challenging way. Language barriers. If you are new to a country and you are not able to converse with the healthcare staff properly, these language barriers and cultural cultural differences may evoke some kind of insecurities in the patient, and this can lead to some problems with the healthcare staff. And also the drug abuse or alcohol abuse or mental issues can also give patients with these kind of problems. Next, I will tell what are the characteristics of this difficult patient. Why I am telling this, you need to understand these kind of patients in your area of practice and prepare a scenario accordingly so that when you get these questions for the interview, you can answer it in a better way. So try to find out a scenario question for you based on your area of practice from the characteristics which I am going to tell you. Okay, so the first one is verbally aggressive. If the patient is verbally aggressive, he will be yelling or threatening to you. Then some other patients may be non-compliant with the treatment. They may not want to get proper treatment. They want to take medications on time. They will refuse any blood test, or they may refuse any treatment like wound care. Next is demanding patients. We mostly see this kind of patients. That is, they will have a lot of unrealistic expectations from the healthcare staff. So they will be giving all complaints to the healthcare staff about the care they received, or about the food they receive, about the medications which they are getting. So these kind of patients goes into this difficult patient category. Next is manipulative and attention seeking patients, especially in the antenatal wards and postnatal wards. We can see, I mean, maybe because of the medical things which they are undergoing that particular kind of time, like hormonal imbalances and everything. And also in psychiatric wards you can see these kind of patients, like attention seekers and manipulative persons. If you have come across with that kind of patients, so you can prepare your scenario according to this. And next is confused or disoriented patients. If you are working in a medical ward, so you you might have seen many patients who is suffering with dementia or any other delirium or intoxication. So that kind of patients. And also withdrawn or uncooperative patients, like if a patient is in depression, the patient may not be interacting with us or may not be responding to our queries or requests. So that kind of patients is also considered as a difficult patient. And also the patient who are physically and verbally abusive towards the healthcare staff, that also categorized as a difficult patient. So decide from these things which scenario you are going to select as your answer. And compiling all the informations which I am sharing in this video, you can prepare your answer for this particular question. I think these informations are enough to understand about the difficult patient. Now I will discuss what are the things you need to discuss when you give your answer to the interviewer. Okay, so these are the keywords definitely you need to include while you explain about the management of a difficult patient. The first one is your communication skills. Project your communication skills, and the way you handle that patient. What are the communication techniques you have used? I will discuss all these things later. And the second one is empathy and professionalism. Third one is cultural awareness. Then the next is awareness about the policies. Then the de-escalation techniques, patient safety and dignity, teamwork and escalation when needed. So these are the primary keywords you need to include in your answer. So when you explain about the management of a difficult patient, you need to include all these keywords in your answer, like professionalism, your communication skill, you escalated the situation to the senior staff when it was needed, and you were well aware about the hospital policies related to management of the difficult patient. See, like that, these are all keywords. If you are including in your answer, this is what they are expecting from you. So definitely you will score in that interview. Then when you are including or showcasing your communication skill in managing the difficult patient to the interviewer, what all things you need to discuss? You can tell, I will use I talk to the patient in a calm and a clear manner without using any complicated medical words, and I was very attentive and I attentively listened to the patient so that he gets an opportunity to explain what is going on. And I will also take care about the body language and the gestures which I am using. So all these things you can include while you showcase your skill in communication. And to showcase the empathy and professionalism, you can come up with validating the feelings of the patient. Like if the patient is saying, I am upset and I don't want to discuss with you anything. When the patient told like that, I requested the patient that please, I really understand you are upset and all these things are overwhelming to you, but I really want to help you. That's why I am again request you to discuss things forward, so that I can extend more help to you, so that you can manage the situation. Okay, so these kind of validation techniques I used to show my empathy towards the patient, like that, and I will stay composed even the patient is aggressive and verbally abusive to me. And if the then if the patient is aggressive, I will try to set the boundaries, but without compromising the quality of care. If the patient does really want to go out and insisting, I want to go out now, and this is not the time for that, then you are telling, you can tell the patient that, okay, I understand you really want to go out now, but this is not the time, because this is not safer time for you to go out and sit alone over there. That's why I can't allow you to go over there. So these kind of setting up of boundaries is coming up with the points like this will help you to showcase your empathy and professionalism to the industry. Next is cultural awareness. You need to understand that people come from different cultural backgrounds, and they have different beliefs, actions, and backgrounds and values. So you need to understand, and you need to also understand your cultural background, because otherwise you will be if you are not understanding your beliefs and your cultural values, you may tempt to judgmental, you may tend to be judgmental over the patient's value systems. And also you should be able to adapt yourself to the cultural needs of the patient. If you want to present yourself as a nurse who understand the cultural differences, then you can mention about the usage of interpreters while giving care to the patient, and acknowledge and respect cultural differences while caring a patient from a different ethnicity. And also I will have a better self-control on my tone, the language, and the gestures which I use while caring a patient from a different cultural background. Now, when you answer, you want to make the interviewer know that you are aware about the importance of knowing the policies while handling a difficult patient. You can mention about all these things like workplace violence and aggression policy, that is how to identify, manage, and report aggressive behaviors, and NSQHS standards, especially standard 5 and 8, which describes about patient-centered care, preventing harm and communication during challenging behaviors, and code of conduct for nurses by NMBA, in which the professional boundaries, respectful care, and dealing with abuse and threat is discussed. Next is restraint minimization policy, when and how to use restraints and with dignity and consent where possible. Open disclosure policy, that is transparency after incidents and conflicts. Cultural safety framework supports respectful, culturally appropriate care, especially for Aboriginals and Torres Strait Islander patients. Then clinical escalation protocols, when to involve security, mental health, or senior staff in health risk situations. So try to mention about one or two things from the headings from these, so that the interviewer gets an idea that you know about various kind of policies which is related to the management of handling a difficult patient. Next, you can talk about the de-escalation techniques. So, what is de-escalation? De-escalation is a set of calm, respectful communication and behavior strategies used to reduce a patient's anger, agitation, or aggression and prevent a situation from becoming unsafe. It's about calming things down before they reach a crisis. So, the de-escalation techniques which you can mention in your answer are: stay calm and non-threatening by using low-tone, gentle body language, give patients space and time to calm down, redirect or distracted when needed, avoid arguing or confrontation. Next, to show that how you will ensure patient safety and dignity, you can come up with answers like if the patient is aggressive, I will scan patient. I will scan the patient surroundings for any hazardous items like scissors, knife, or forks, so that I can remove them and ensure proper patient safety. And if the patient is becoming aggressive or crying, I would like to provide privacy by drawing the curtain or lowering my voice so that others cannot hear the conversation. And I will use gentle touch and explanation during the care. And whenever even though the patient is aggressive, I will never shame or belittle them. So these are the techniques which you can project to show that you are concerned about the patient safety and dignity while you care for a difficult patient. In teamwork and escalation when needed, you can include points like calling RN for further help and calling security when the patient is becoming uncontrollable or physically abusive, and or the mental health professional for further professional care, and debriefing your team about the situations you have faced and what worked and what not worked for that patient, because sometimes for the next day your co-workers may be getting this patient for care, so he or she can plan care accordingly. So this debriefing will also help. This adds to the teamwork. So these are the points you need to include while you answer handling a difficult patient. But remember, you don't have to include all these points in your answer. I told you to select the scenario according to your area of practice and find out the keywords and the situations and the points which you can include in your answer. So I will give you an example for that, inculcating all these points. Let's see that. This is an example for that question. I will use calm, clear communication and active listening to build trust, especially with distressed or upset patients. Even when patient is challenging, I treat them with empathy and maintain professional boundaries at all times. In an intense situation, I use de-escalation by staying calm, giving space, and speaking gently to diffuse tension. I always prioritize patient safety and dignity even when their behavior is difficult. I don't hesitate to escalate if safety is at risk, and I always involve my team to manage care effectively. So you can give answer in this way, or else you can use scenarios to describe your answer. So if you are using scenarios, you can go for STAR method. That is, you can explain about the situation, that is what is happening in that situation particularly, and the task, what was your role, what was your intention of doing, and action, what you did, and what was the result, what was the outcome. So in that format, if you are giving an answer in a scenario based way, you can formulate your answer like this. While working on a medical surgical ward during my clinical placement, I cared for a patient who had dementia and was becoming increasingly agitated and verbally abusive during evening shift. My responsibility was to ensure patient safety and comfort while also preventing any risk to other patients and staff. Remained calm, used a soft and reassuring tone, and maintained a safe distance. I used active listening to try to understand what was distressing them. I avoided arguing, validated their feelings, and redirected their attention to something confronting like family photo at their bedside. I also documented the behavior, informed RN in charge, and we reviewed their care plan to introduce strategies like music therapy and consistency in staffing. The patient calmed down that evening, and over the next few shifts, their episodes become less frequent. The team also praised my communication skills and empathy. So in this way also you can tailor your answer. So this was about the video. handling a difficult patient. I know there is a lot of information, but you don't have to by heart all this information. Identify a particular scenario which is related to your area of practice, and frame an answer and practice that answer, so that when when this question is asked to you, you can come up with good answers. And all the best for those who are looking forward to give the interviews, and I will come up with more interview related questions. And if possible, please subscribe our channel, and see you in the next video.